everyone, welcome to our YouTube channel, NEET Talks. Myself, Upasona Panday. I'm a first prof medico from Nilratan Sirkar Medical College and Hospital. In this video, we'll be talking about the generation and the conduction of the nerve impulse. हम माफ़ी मांग लेते हैं, वीडियो डालने में थोड़ा सा लेट हो गया, पर कोई बात नहीं, आगे का वीडियो सब टाइम में ही आएगा. ठीक है, चलो स्टार्ट करते हैं, वीडियो देखते हैं. और हाँ, follow us on Instagram. There we'll be giving about the updates of our upcoming videos, and also follow us on Telegram. In Telegram, we will be providing the notes and also a lot of question papers, not only of biology, also of physics and chemistry. Okay, so from the link in the given description, follow us on Instagram and Telegram. Okay. We'll be talking about the generation and the conduction of the nerve impulse. The topics that we need to know are the resting membrane potential, the action potential, the conduction of the impulse, and the synapse. Probably we'll be talking about the synapse in the next video. In this video, we'll be clearing the concepts of the above three topics. तो चलो start करते हैं. तो चलो resting membrane potential समझते हैं. We have taken this schematic diagram of the neuron to understand the ionic activities that are taking place in the membrane of the neuron. More appropriately in the membrane of the axon. सही है, चलो देखते हैं. The membrane of the axon is freely permeable to the K+ ions. This results in lots of influx of the K+ ions. But the membrane is nearly impermeable to the Na+ ions and the negative ions. What happens? Now, as a result, the exoplasm becomes rich in the negative ions, which are not allowed to go out of the neuron. Similarly, the Na+ ions present outside the cell membrane are not allowed to enter the exoplasm. This results in decreased amount of Na+ ions inside the cell. This is the result of the selective permeability of the axonal membrane. The cell membrane is selectively permeable that allows the K+ ion to enter the cell but does not allow the Na+ ion to enter the cell, neither allows the negative ions to leave the cell. Moreover, this Na+, K+, ATPase pump actively pumps out 3 Na+ ions and pumps in 2 K+ ion. This also gives rise to some concentration gradient inside and outside the axonal membrane. All these factors result in that inside the cell there is lots of potassium ions. You see, there are lots of potassium ions, lots of negatively charged ions, but very few sodium ions. Similarly, outside the cell membrane, it becomes rich in lot of sodium ions. There are lot of sodium ions present outside the cell membrane. This gives rise to some charge, to some potential in the two sides of the cell membrane. Due to lot of negative ions and potassium ions inside the cell, the inner side of the cell membrane becomes relatively negative in potential. With respect to the outside of the cell membrane, that becomes positive in potential due to the abundance of the sodium ions. So we can say that the cell membrane is polarized. The cell membrane is polarized. This difference in the potential at the two sides of the cell membrane is known as the resting membrane potential. This is what is called as the resting membrane potential. So, we're done with the resting membrane potential. अब हम क्या देखेंगे? अब हम जाएंगे the generation of impulse. So, the scenario of the exoplasm is clear to us. अब क्या होता है? Suppose the axon is stimulated. There is some stimulus provided to the neuron. The stimulus result in the opening of the Na plus ions. The voltage gated Na plus channels are opened. जो अभी तक बंद थे, जिसको परमिट नहीं करता था सेल मेम्ब्रेन, वो सारे चैनल्स ओपन हो गया है. Those are the voltage gated sodium channels. As these channels open up, there is a rapid influx of the sodium ions inside the cell. This rapid influx increases the concentration of the sodium ions inside the cell. ये जा रहा है, इधर स्टिमुलस लगा, चैनल खुल गया, सोडियम अंदर चला गया. अब सेल का सिनेरियो क्या है? वो पोटेशियम जैसा था वैसा है, नेगेटिवली चार्ज आयन जैसा था वैसा है, सोडियम तो कुछ था, और इधर से ना बहुत सारा सोडियम अंदर घुस गया. Here occurs some reverse in the polarity of the cell membrane. Due to the rapid influx of the sodium ions, the inner side of the cell membrane becomes positively charged. Positive potential with respect to the outer side of the cell membrane. This event taking place is known as the depolarization. So what is the depolarization? Now this depolarization is the event in which there is the opening of the voltage gated sodium channels that result in the rapid influx of the sodium ions and causes a reversal of the polarity of the cell membrane, which makes the inner side of the cell membrane positively charged and the outer side negatively charged. This is known as depolarization. तो जब हम पूरा सेल के देखेंगे तो क्या होता है? देखो, सपोज इधर स्टिमुलस लगा है और इधर का वोल्टेज गेटेड सोडियम चैनल्स खुल गया है, तो सोडियम अंदर जा रहा है, बहुत सारा सोडियम घुस गया भाई अंदर. तो the inner side of the membrane becomes positively charged and the outer side becomes negatively charged. पर ये तो भाई जहां स्टिमुलस लगा उधर हो रहा है, बाकी पूरा एक्शन तो जैसे का तैसा ही है. So now there is two types of potentials occurring. Inside the cell there is one potential occurring, the one potential difference, one potential difference that is occurring, and outside the cell there is also change in the potential difference. So when we deal with the inside, just होता है उधर का अंदर, उधर का सेल मेम्ब्रेन का अंदर पॉजिटिव हो गया है, पर उसके सक्सेडिंग पार्ट में तो वो जैसा नेगेटिव था वैसा नेगेटिव ही तो है. तो हम इसको नामकरण करते हैं इन रीजन्स का. सपोज दिस इज रीजन ए, दिस रेड रीजन इज रीजन ए, दिस इज बी. This stimulus is given to region A, so there is some reversal in the polarity. The inner side becomes positive and the outer side becomes negative. But the region B, it is in resting membrane potential, so the inner side is negative and the outer side is positive. So inside the axon, there is some flow of current from the positive charge to the negative charge. So inside the cell, current will be flowing from region A to region B. But when we look at the outside, the region B is positive and the region A is negative. So there will be some flow of current from region B to region A, completing the circuit. फिर करंट फ्लो हो गया. अब क्या होगा? ये जो रीजन ए था ना, ये रेस्टिंग मेम्ब्रेन पोटेंशियल पे आ गया. Here occurs repolarization. We will be discussing the repolarization. But पहले ये देख लेते हैं. तो रीजन ए रेस्टिंग मेम्ब्रेन पोटेंशियल पे आ गया. अब देखो जादू हो गया भाई. ये रीजन बी, now this region B is depolarized. Due to the complete of the circuit in the region A and the region B, the region A has gained the resting membrane potential, and the region B, in region B, there occurred the reversal of the polarity. Now the region succeeding the region C. So the same event will again occur from inside the cell. From region B to region C, the current will flow, and outside the cell membrane from region C to region B. In this way, it will occur in the progressive way, conducting the impulse. You see, the impulse is moving forward. In this way, the conduction of the impulse is taking place. तो हम इसके बारे में तो बात कर ही लिए. The Na plus channels opens very rapidly. Then there is a rapid influx of the Na plus ions inside the cell, but this influx is very short-lived, extremely short-lived. जैसे ही बहुत सारा सोडियम घुस जाता है सेल के अंदर, वैसे ही ना वो चैनल्स बंद हो जाता है. क्यों बंद होता है? उसके लिए ना कारण है. पहले तो एक ये है कि ये वोल्टेज गेटेड चैनल्स है. तो जब वोल्टेज में बहुत सारा चेंज आ रहा है, क्योंकि जब सोडियम आयंस अंदर जा रहा है तो पोलैरिटी चेंज हो रहा है, तो जैसे कि वो पोटेंशियल डिफरेंस बहुत ज्यादा हो रहा है, तो वो चैनल्स बंद हो सकता है. और क्या होता है ना, ये चैनल्स ना टाइम डिपेंडेंट है कि ये छोटा सा टाइम के लिए खुल सकता है, उसके बाद में ये बंद हो जाएगा. और क्या होता है, तो बहुत सारा पॉजिटिव चार्ज चला गया अंदर, इसके लिए बंद होगा. और साथ ही साथ द पोटेशियम आयन चैनल्स ओपन. एट दिस टाइम द पोटेशियम आयन चैनल्स ओपन and there occurs the efflux of the K plus ions from the cell. This event is known as the repolarization. So what is the repolarization? Now repolarization is the event in which the sodium ion, the voltage gated sodium ion channels closed, the potassium ion channels open, and there is the efflux of the potassium ion channels. That is known as the repolarization. And this repolarization restores the resting membrane potential. देखो, ये depolarization है influx of sodium ions, and repolarization means the closure of the sodium channels, opening of the K plus channels, and the diffusing out of the K plus, restoring the resting membrane potential. So this is known as repolarization. सही है? So these are the events. देखो, पहले तो स्टिमुलस आता है. स्टिमुलस आने के बाद क्या होता है, सोडियम चैनल्स खुल जाता है, बहुत सारे सोडियम अंदर घुस जाता है. दिस इज नोन एज depolarization. The polarity of the membrane changes, the inner side becomes positively charged and the outer side becomes negative in potential. फिर क्या होता है, ऐसे सब चेंज करके वो जो वोल्टेज गेटेड सोडियम चैनल्स था वो खुद ही बंद हो गया. कुछ तो करना होगा, पोटेशियम आयन चैनल्स खुल जाता है. पोटेशियम आयन चैनल जब खुल जाता है तो बहुत सारे पोटेशियम आयन्स बाहर डिफ्यूज कर जाता है, रिस्टोरिंग द मेम्ब्रेन potential, and this is known as repolarization. So these are the sets of events that are taking place. All these events are togetherly known as the action potential. What is that action potential? Now this is the sequential change in the membrane potential due to change in the concentration of the various ions that occurs due to the opening and the closing of the ion channels and the conduction of the impulse throughout the nerve pathway in undiminished way. This is known as action potential. Okay? ये ग्राफ दिख रहा है? This is the graph of the action potential. This graph tells us about the series of events, that is the depolarization, repolarization, hyperpolarization, and also some new terms like the threshold stimulus will be knowing that, and also the role of the ions that help in the progress of the action potential, but we'll be looking after this in the next video. तो वीडियो देख लिया. In the next video, we will be completing the graph of the action potential and we will be taking up the synapse and we will have a detailed discussion on that. ठीक है? So the next video will be coming on that action potential, the rest portion of the action potential and the synapse. Okay? So stay tuned and take care. Bye-bye. Bye-bye.